Hereby I open this academic ceremony in which Georgios Agorastos will defend the academic thesis Unraveling Mouthfeel, a novel approach to understand taste. May I invite you to present a summary of your study and the conclusions of your thesis.
Thank you. Dear Prorector, members of the committee, family and friends. In the next 15 minutes, I'm going to be presenting my thesis dissertation with title Unraveling Mouthfeel. But before speaking about mouthfeel, I would like to give a small introduction about the definition of taste, tasting, and flavor. What is actually taste? Taste are the molecules that are present in the food, while tasting is the perception during consumption. And on the other hand, we have flavor. Flavor is the conjunction between taste, texture, and smell, and you have different receptor systems, and they are the trigeminal, gustatory, olfactory systems. But why taste is so important? 70 to 80% of new products fail within a year from the market. A taste is considered to be one of the main rejection factors for this. But in order to improve the success of products, we have to overcome different challenges. And first of all, one is in taste evaluation. What is happening now is that we have sensory analysis that we're using human panelists, and this is quite subjective. And so this introduced quite some error, and also at the moment we have different fuzzy sensory attributes, so it is quite difficult for the panelists to distinguish what is happening. But also we have different complicated lexicon and mouthfeel wheels and taste wheels, and this creates a bit of a problem on the miscommunication between consumers and panelists and product developers. And this brings me to my main topic, that is mouthfeel. And what is exactly mouthfeel? Mouthfeel is part of the texture, and this exactly is the tactile, irritant, and thermal sensations upon consumption. And I focus mostly on the tactile sensations during my thesis. And there are two different properties that dominate these sensations, especially on beverages, and these are bulk and surface properties. But how can you really measure mouthfeel? Mouthfeel, you can measure it with a soft tribology. And what you actually measure with a soft tribology, you measure friction. And what is unique with soft tribology is that you use hydrophobic PDMS, mimicking the oral surfaces. And what is really important is that saliva proteins are the natural lubricants in the mouth, and therefore changes in the salivary film, and therefore in the lubrication, can generate different oral sensations. And this brings me to my main aims, and the first was to investigate the current mouthfeel lexical and wheels regarding their application. The second was to investigate the effect on saliva on mouthfeel sensation. Third was to understand the interactions between food components and saliva proteins and their impact on salivary lubrication. And the last was to apply new finding knowledge in empirical experiments while evaluating the mouthfeel model. And this brings me on my first question. So the first was a review chapter when we explored the current mouthfeel terminology and the different classification approaches. And basically what we discovered in the literature are that there are different sensory attributes that are quite fuzzy. So this is quite difficult for the panelists to classify mouthfeel based on this, and therefore this brings to high correlation. And also the mouthfeel wheels that are used now, they're really complicated. So panelists are quite less effective. And therefore, we suggest the mouthfeel model, and the mouthfeel model is a better tool for the classification of mouthfeel. And this is basically on the 3 different dimensions, and this is drying, coating, and contracting. But also, we reveal different classification approaches that we can classify mouthfeel. The first is the product approach that is really objective, and this is really about the food components, the molecules, and this is before the swallowing part. We have a second one that is product-human interaction, and this is a bit more subjective than the previous one. And this is during swallowing, and there are the different interactions that happens in the mouth. And the last is the human approach, and this is completely subjective, and this is the final perception, what we perceive after the swallowing. After we got a good grasp on the terminology, then we try to understand the oral sensations, and therefore we investigate the effect of saliva on mouthfeel sensations, and also we investigate the mechanism of the tactile sensation as well. The main results of this chapter is that the saliva proteins are really unique compound in the oral cavity, and this provides really good lubrication. And also we put a lot of emphasis on the drying And that is a drying succession that is part of the tactile successions, and especially on the astringency. And we highlight mostly the friction-based theory. When you have different astringent agents, such as polyphenols, they aggregate with salivary proteins, and this leads to lubrication loss. And also in this chapter, we highlight shortly the different physiological factors and how this can potentially influence mouthfeel and saliva. So these factors are age, disease, and medication. And actually, these different categories can change the saliva properties, and this can lead to different mouthfeel sensations between different groups. And this brings me to my next chapter, when we want to investigate the effect of different food components in the parenchyma in the saliva. Therefore, we investigate the effect of polyphenol and manoproteins on salivary lubrication by the use of the soft tribology. So the main results is that the larger molecular weights, like tannins, they're much bigger molecules than the gallic acid, provide higher friction in the oral, in the saliva. And this is because we have aggregation formation, and also we saw a really good correlation between increasing friction and increasing the hydrodynamic diameter, so on the aggregate formation. And also, when we introduce manoproteins, we saw a masking effect. So in the presence of manoproteins, the gallic acid shows less induced friction, and this is basically because manoproteins interact with gallic acid. Therefore, the gallic acid has less affinity to salivary proteins. On the next chapter, we want to understand a bit better what is happening with the phenols. Therefore, we select 4 different phenols with different molecular characteristics. So that, therefore, our aim was to investigate the effect of phenols characteristics on salivary lubrication and investigate the reason of lubrication loss. The main results are that a higher amount of hydroxyl at the gallolic groups provide higher friction. This is because of the more interaction that happens with saliva proteins due to this higher amount of the groups. And also we investigate and we prove that mucins and glycosylate proline-rich proteins are the main proteins in saliva that are responsible for the lubrication loss. So when these proteins are getting aggregated, then we see that the lubrication ability drops. And also we did a series of different physical measurements when we measure the related density of the proteins, the diameter, and the wetting properties. And we did a Pearson correlation with the friction, and we found that the wetting properties of the saliva is so the highest correlations with the friction, and therefore we can get an idea that they really dominate the lubrication. On the next chapter, we decide to increase the complexity, so we introduce different salts that are present in beverages, and therefore we investigate the effect of different valencies on salivary lubrication, and also we try to understand the association of cations with phenols and what happened on the salivary lubrication. On this chapter, we prove that the monovalent salts provide higher lubrication, and probably this is due to the hydration lubrication due to the monovalent salts. But on the other hand, when we have trivalent salts, such as iron or aluminum, this aggregates mucins, and this is due to the salting bridges. But also quite interesting, when we have a phenol, such as a picalocatechin gallate, can interact with iron due to the chelating interactions, and this can prevent lubrication loss. And it's quite fascinating because actually there are both of them astringent agents, but from the time they interact with each other, then there is less affinity of the astringent agent to interact with saliva proteins. And last, we evaluate the application of the mouthfeel model based on a real case scenario when we use 24 beers, and also we investigate the correlation between sensory and instrumental analysis. So the main outcome of this research is that the mouthfeel model is a really good tool for classifying beverages, such as beer. And actually, we have 2 main dimensions. We have the tactile sensations and the chemesthetic sensations. And the tactile sensations actually is the drying the coating axis of the mouthfeel model, when the chemesthetic sensation corresponds more on the contracting axis. And also, we found a really good correlation between the instrumental data and the sensory. This shows the potential of having more objective approach of classifying, but also predicting mouthfeel in the future. Therefore, those are my main conclusions. Saliva is an important parameter affecting oral cessation. Chemical characteristics such as pH, molecular weight, cationic valencies, and ionic strength significantly influence oral cessations. Acids and agents can interact with each other and lower the induced friction. Mouthfeel model is a sufficient tool to capture the mouthfeel cessation in beverages. And the last instrumental analysis can be used to predict mouthfeel cessation. And this brings me to my future perspectives. It will be great in the future if we can evaluate the effectiveness of mouthfeel on solid products, and also to understand the effect of the different physiological parameters, medical condition, and medication, and how change the saliva properties, and also generally how change the mouthfeel and the flavor perception. And last is to create a better prediction for taste and flavor based on more objective measurements. And nowadays we have artificial intelligence that can develop better models, and therefore we can have better prediction and the classification of mouthfeel. Thank you for the attention. I can give my word back to the prorector.
Thank you very much for your clear presentation. Well, before we move over to the opposition, let me first welcome you all for attending this audience. And I would like to introduce also the supervisory team, Professor Bast and Dr. Klosse. According to Maastricht custom, they will not be asking questions, so you might be wondering otherwise, what are these people sitting in this committee? Also good to know, today we have a hybrid defense, meaning that two of the opponents will be acting online from further away abroad. So we're going to move and use the technology a couple of times. My own name is Ralf Peters. I'm acting as today's pro-rector and guiding you through this session. Well, then let's start with the opposition. The opposition will be opened by Professor Havermans. Professor Havermans was chair of the assessment committee and is acting as today's secretary to the defense committee. He holds a chair in youth, food and health at the campus fellow of Maastricht University. Please, Professor Havermans.
Thank you. Dear candidate, I've enjoyed reading your thesis to learn about your thoughts and, of course, your studies on mouthfeel, how salivation contributes to mouthfeel, how salivary lubrication is affected by different compounds, as you just showed. But I am a psychologist, and I like beer. So I admit I was especially intrigued by the study you described in Chapter 7, where you had beer, sommelier experts taste and rate attributes of 24 beers. A study that was recently published in the International Journal of Gastronomy and Food Science. Nice. But I do have a question about particularly this study. I've read this chapter now multiple times, and I still don't know exactly what your beer experts needed to do during the sensory evaluation of the 24 beers after they received their panel training. So can you explain the procedure a bit more to me?
Highly esteemed opponent, thank you for your kind words and for the question. Actually, so first of all, we did a screening on the panelists based on an online questionnaire and with different factors. And when they passed these requirements, they were invited to a first session when we introduced them to the mouthfeel model and how they can do evaluation based on the mouthfeel model. And also, we gave them some kits that they represented different axes, like the drying, coating, contracting. And the next part, we had 18 sensory panelists. And what we actually did, we had two sessions. We had two sessions that actually we trained them on the mouthfeel model, but also on different matrix interferes. And what I mean with this, so we had the beer, and we inject different compounds, and actually based on this, they were trained. And after we told them to classify the beer based on the different attributes, such as carbonation, coating, sweetness, acidity, contracting, drying, bitterness, and burning. And they had to evaluate from a scale to 1 to 10.
Sure, that I understood. Yeah. That's nice. But then what happened? So then they were fully trained, and then these panelists had to do what?
So they had to, so they received different beer samples. They were in a random order, so they had to evaluate them with online questionnaire. Does this answer the?
Almost.
Okay.
We're not there yet.
Okay.
Because that I understood as well, but you say that they were tasted in a random order, all 24 samples?
All of them.
All
yes.
24 samples were tasted in a random order per panelist?
Per panelist. Yeah. And
nice.
also the different beers per panelist. So not the same panelist is going to receive the same sample, so to avoid any variation in this. So all the time the panelists were getting a different set of beers.
Yeah. But still every panelist received in total all 24 samples.
Exactly, yeah.
That's 1.2 liters of beer in total.
Ah, okay, yeah. And they had to spit out the sample. Yeah.
So it was sip and spit.
Exactly.
All right, so there was no problem of rising blood alcohol concentration?
No, likely not.
Good. Good that you cleared that up. Thank you very much. So well, you do write that after 8 samples, they had a 30-minute break, right? Long break.
Yeah.
And was that the one and only break they had?
If I remember correctly, there were two breaks. Two breaks.
So every 8 samples.
Exactly.
30-minute break.
Yeah.
So in total, how much time were they
I think
involved in the tasting?
It was around an hour. And
excluding the 1 hour of breaks.
The breaks, they were only an hour, I will say. And then the tasting was a bit faster. I think the whole procedure, we had in different sessions actually. We had in the morning, in the evening, and so the first day we had the training, and the second day we had the evaluation. So we had the 3 different clusters.
All right. Yeah. Now I see.
Yeah.
Thanks. Thank you very much. Yeah. That's good. I have another question then, more related to the results that you describe in your discussion for the sensory evaluation, because you describe that your panelists could not distinguish between bitter taste and drying sensation, between sweet taste and coating, and between sour taste and contracting.
Yes.
Good. And these correlation coefficients are so high. Aren't these measurements then completely interchangeable, right? These correlation coefficients are around 0.90. They're the same thing.
Yeah.
They're the same thing. So this implies then that you can describe beer in terms of either basic taste qualities, sweet, sour, bitter, or drying, contracting, and coating. And you seem to prefer the latter, right?
Exactly.
So you forget about these high correlations. It's all about the 3 dimensions of mouthfeel. But I don't understand why you do that. I really don't. Because normal people talk about taste of beer, right? So most people are completely able and comfortable to identify the basic taste of a beer, mostly bitter or mostly sweet or mostly sour. And I presume a little bit less comfortable in using these mouthfeel terms, even though they're quite straightforward. So I would think I would prefer to then stick with the basic taste descriptions instead of the mouthfeel sensation. So again, can you explain why that's different for you?
Yeah, thank you for the question, first of all. What is unique with the mouthfeel model is it's a bit simple model. So the panelist does not have to go through a really long questionnaire that you have 20 attributes, even if they're referring to taste or different elements. And therefore, you have a really nice umbrella that is represented by this axis. And also the other part is usually when you speak about taste, you have molecules like sweetness, like sugar. Sugar does not only activate the gustatory receptor, but it's going to also change the viscosity. Therefore, by the coating axis, you combine those 2 elements together, and therefore it's easier for the panelists. However, they have to get educated and to be familiar with the mouthfeel terminology, because of course it's a bit different than the classic approach, but that's also let's say the beauty of it.
Now, I understand, the mouthfeel model that you describe with the 3 dimensions is indeed simpler and far more straightforward than existing mouthfeel wheels. I agree that those are too complex to be of any practical use. But relative to descriptions purely in terms of basic taste, right? People do not need training, that's my point. People do not need training in identifying the basic taste quality of a food or a beverage, whereas they do still need a little bit of training to get used to the terminology of drying, coating, and contracting. So why then prefer drying, coating, contracting classification and not so much relying on a more, in my view, easier description in terms of basic tastes?
Definitely see your point.
Thank you.
Of course, it's easier because it's more or less it's taught in this way. Mm-hmm. But in our approach, it's like basic tastes until now they're failing to really classify sensations. Like until now we do not unravel how we can really quantify taste, how we can really classify mouthfeel, and actually we believe that with the application of the mouthfeel model we can be a bit more objective about this. Mm-hmm. Like also what we see on the beer chapter, like we can have a really nice graph, and then it's a bit easier. So let's say the subjectivity is less, and we have more objective results.
Mm-hmm. Okay, thank you.
Thank you very much.
Thank you, Professor Havermans. The opposition will then be continued online by Professor Ritsulis. Professor Ritsulis is a member of the assessment committee, and he holds a chair in food chemistry at the Department of Food Science and Technology of the International Hellenic University in Thessaloniki. Professor Ritsulis.
Hello, on my behalf. Georgios, congratulations on reaching this stage of your PhD defense. I have enjoyed your presentation, and on your thesis, I most enjoyed the discussion on the colloidal phenomenon tribology. And my favorite was a clear correlation between macromolecular size increase, probably aggregation, and increase in friction. So my question that comes out of this is, you started measuring the phenol concentration, say, as grams per liter and not as mole per liter. So I wonder if potentially you were using molarities instead of percentages, couldn't you get some extra information on the stoichiometry and perhaps account for the differences in polyphenolic activity? Let's say your correlation between different phenols of the same concentration and the friction coefficient.
Highly esteemed opponent, thank you for your kind words and for the question. Indeed, on the third chapter, we use grams per liter, and after we changed on the molarities. And actually, we have some data that are not published on the thesis, and we indeed use gallic acid and tannins as well on the same molarity. We try to plot the different characteristics, but unfortunately, we did not gain something really unique at this stage. And yeah, definitely there is a lot of... Sorry, I did not hear?
You did try in the end.
Yes, indeed.
Yes, okay. Yeah, please.
Let's say there was not a strong behavior that we identified. So we had a big range of polyphenols, including gallic acid and tannins, but in the end was not a clear behavior that from the molecular perspectives. We do not find a really good correlation between the different amount of hydroxyl groups that are present or the molecular weight. But maybe if you apply a bit more sophisticated models, like using artificial intelligence, because what we actually did back then was like a simple regression, maybe there is a better pathway that we can find something significant.
Thank you. And coming to your analysis that you mentioned, I see that you use two different p-values. You use 0.001 in some cases, and 0.05 in other cases. The latter one is typically the most widely used. So why did you choose to jump between one p-value to the other during your experiments and results presentation? Actually, there is a table where you use both.
Thank you for the questions. Actually, we chose it. Okay, it's really hard to say that something is more significant than something else, but actually it was like we got different p-values, and basically what we found was like when we had 2 digits, then we had 0.05, and when one was really significant, then we were using the 0.001. That was the main reason.
Thank you very much. This is all for me concerning your fine thesis. Thank you.
Very much.
Thank you, Professor Ritsulis. Then the opposition will be continued by Professor Drent. Professor Drent was a member of the assessment committee and holds a chair in interstitial lung diseases at the Department of Pharmacology and Toxicology at the Faculty of Health, Medicine and Life Sciences at Maastricht University. Professor Drent.
Thank you. First of all, I also would like to congratulate with finalizing your thesis and your studies, despite all the problems you had to face during the COVID period, I was told. It's about a unique, a new and original subject, the experience of taste. Of course, I would also like to congratulate your promoter and co-promoter. It's an interesting topic you're bringing up. When I went through the thesis, I get many questions, and I would like to discuss with you a few. To start with, as a clinician, I'm interested how you can improve the taste of food in patients who take drugs that negatively affect their taste. You presented some drugs in your presentation, and they were about the effect on saliva, but there are other drugs like methotrexate, anti-inflammatory drugs, and of course there is a complication because of the underlying disease, but that you can ignore on my behalf. Could you add an extra substance in a drink or additional to the drug, to the medication, which improves the taste and in turn the quality of life, which you also mentioned in your presentation? Could you speculate on that?
Highly esteemed opponent, thank you for your kind words and the question. Indeed, it's really important, I think, this point. And I believe there are 2 different aspects of this question. Actually, it's like maybe we can improve with medication, actually, to improve the saliva. And what actually happens often is like also that the mucins does not behave that well, and also the production of the glands is not as supposed to be. So maybe we can change something so we can have a better lubrication by medication. And the other aspect is indeed by formulation. So we can use different formulation on foods that we can use to provide better lubrication for the patients, for instance.
That means that prescription of drug needs to be more personalized, because if you consider also the underlying disease, perhaps then with one disease you have to prescribe another substance than in another disease. So this is very interesting for the future, I think.
Yeah.
Exactly. Another question, chapter 7 is very popular, you can imagine. You described the instrumental beer classification based on mouthfeel. But I don't want to go more in depth in that. But the introduction of non-alcoholic beer has provoked a lot of resistance in real beer drinkers. Their main argument is that it does not induce the beer feeling in the mouth. Considering this, what exactly is the role of alcohol or ethanol, if you wish, in beer taste and mouthfeel? Alcohol has been reported to cause a kind of prickling, tinkling, even burning sensation. How could the experience of non-alcoholic beer be improved after the results of your studies? Is there a substance that can mimic the alcohol effect of beer? And I wonder, how does this fit into your model?
Thank you for the question. Indeed, really nice approach. Now it's a big trend, the not alcoholic beverages, but there are a lot of things to take into account. So one is the bearings ascension that we have due to the ethanol, but also the other is the lubrication behavior. Like ethanol has a different lubrication behavior. Therefore, we have to change the recipe, and we have to be also clever in this way. And what we have seen nowadays in the market, they use different compounds as a capsaicin, for instance. And this one brings bearings ascension. But actually, the bearings ascension is not as close as with ethanol.
Mm-hmm.
And on the second part of the question, actually, we could use the mouthfeel model, because the mouthfeel model is a really nice three-dimensional model. And based on this, we can take into account the coating part that we can get from the tactile sensations, but also we can get the chemesthetic part as well. So we can see a really nice behavior between not alcoholic and alcoholic beverages, and then we can see how we can adjust the recipe.
So there might be a future for alcohol-free beer?
I hope so.
Okay. Do we have time for one question? From your thesis, I understand that mouthfeel can be described as the interaction between taste and texture. Food presentation does also affect how food tastes. It has been described that our sight has a great influence on how we experience taste. If food is not presented in an attractive way, it has a negative effect on our overall perception of food taste. Our eyes play a part in how foods ultimately taste. How does the way how food looks like affect taste and sensation of food? Might in turn our brains influence perception of foods? Might it influence your model presented in this thesis? What do you think about that?
And this really nice question. Actually, indeed, there's a lot of cross-modal effects that I have been studying in literature, and indeed, like a vision is a major parameter about how you perceive taste and also about the liking. Actually, I believe like it is better to use the mouthfeel model as a really subjective approach. Mm-hmm. Like when we speak about perception, when it's about sound, seeing something, then it's better, then it's a bit more subjective, and then a lot of interference and errors. What is nice with the mouthfeel model is a really nice beginning to grasp how we can classify mouthfeel on beverages and on foods, and this is a really nice step forward. So definitely we can build up later on this.
Yeah, I don't think you already have the solution now, but I thought, well, probably that has influence as well. That's the main reason of my question. Thank you very much, and I give the word back to the prorector.
Thank you very much, Professor Drent. Then we will move back online again. The opposition will be continued by Professor Bloem. Professor Bloem was a member of the assessment committee. He also chairs environmental health, and he is affiliated with the Department of International Health and also with the Department of Environmental Health and Engineering at the Johns Hopkins Bloomberg School of Public Health in Baltimore in the United States. Professor Bloem.
Thank you, Rector. As the previous professor already mentioned, I would like to congratulate you for an excellent thesis. Very interesting to me, a lot of new materials. I mean, definitely not my expertise, but I read it with great, I would say, pleasure. I also like to congratulate your supervisors, because I think, what I've heard also, that it was a very difficult time on the COVID, and you accomplished all the research. So I think that in itself is already a pretty accomplishment. But I will ask you maybe a little bit questions, not too much about your thesis, but about the implication of the work you have done. And I know it's a bit out your field, but as a public health professor, I think it's important, what the consequences are. And so I have actually two questions. So one question is, coming from a nutrition field and being involved in NCDs, that we know that in fact there is an incredible increase of NCDs all over the world, also in low and middle income countries, more than 70% of the people are now dying from NCDs, not anymore from infectious diseases, despite COVID. And the food industry is actually responsible for many of these problems from a nutrition perspective because of the salt content as well as the sugar content of many of the food products. And so there's a lot of interest by WHO, FAO, trying to reduce the content of these products and in interaction with the industry. At the same time, your findings shows very clearly that there is a decrease in taste among elderly. So, and that should be, you know, those older people, they will actually, you know, like to have an increase in salt, for example. But that again will increase the risk of cardiovascular diseases like hypertension, for example. So how do you like if I read your thesis, on one hand, I felt very optimistic that you could do something about the fact that elderly will have a, you know, decrease, and you could do something about it. At the same time, we are discussing with the industry that in fact it's for the industry extremely difficult to reduce the salt content as well as the sugar content. So what's your opinion about this? That's my first.
Esteemed opponent, thank you for your kind words and the question. Indeed, I believe there is a lot of work that can be done on the elderly population, especially because what actually is happening is like saliva changes. So the lubrication, especially due to the mucins, is reducing. And then people, they have xerostomia. And therefore, in order to have people getting a better nutrition, for instance, you have to modify the product. So you have to induce some lubrication inside, in the product. So then it's a bit easier for the chewing. And based on this, for instance, we can build in different levels. And the other part is actually what happens right now, like in industry, usually you just have salt, fat, sugar. This is what they use, but actually there are more components that you can use and provide better food products in the market.
So do you think that the industry is willing to start to change their product to deal with, in fact, the results of your thesis? Or will that be a challenge?
Be a challenge, but I think this is the correct way to go because physiological factors are really important, and I believe already some industries are working on it. And based on understanding physiological factors, you can have a really nice product per specific group, for instance. And then also the success rate of the product is going to be better because people they can consume it and the liking is going to be higher. But also from a medication point of view, people they can actually eat and get the nutrition that they need.
Okay, so am I allowed to have another question?
Yes, there's plenty of time. Yeah.
Okay, so I read also a very interesting article related to this topic, candidate, and it's about the use of ice cream. Many elderly people, also people with Alzheimer, for example, their taste is much diminished. They don't like food anymore, but they still like ice cream, but they have a lack of nutrients. So what do you think about the potential of using ice cream and thinking about nutrient intake among elderly?
And need a minute thing. Definitely it's a clever approach. I'm not sure what exactly happens in the mouth because you have the cooling effect. So I'm not sure how exactly the saliva is going to respond. So the saliva properties. But if the lubrication is good enough, for instance, for elderly people, and then it's much easier for them to swallow, then definitely can be a really interesting carrier of different medications, for instance, or compounds that we can deliver to elderly for better nutrition.
But you haven't seen this yet as a potential change for the industry?
Not yet. But it definitely is a really good point. Yeah.
Yeah, like, well, if I still, like, you know, it's very interesting for me personally. Of course, coming back to the fact that I think it's important to have the results of your research to be applied. And, what do you think is there, if you would start an institute for taste, for example, what type of research would you like to do to actually support both industry as well as, for example, hospitals, what they can do about these different products? What are the real gap in this field? Because it's just reading your thesis, seems to be innovative work, but at the same time we are far away from, in fact, using it in a proper way instead of just what you said, increasing fat and sugar and salt, or decreasing that for NCDs.
I believe what is actually happening right now is the subjectivity, that how we analyze taste is huge. So actually we cannot really understand what the consumer wants, and also actually what type of consumer. So first of all, it will be great, and I think this is what we try to establish with the Mouthfeel model, to have a really nice base, something that is really objective, and you can build on this. And then you can support more by objective data, for instance, like really speaking about components. And after you can start building also on the perception, on the liking. I think there are different parameters that has to be improved for the future.
Thank you.
Thank you.
Thank you, Professor Bloem. Then we move back on site to this chamber. The opposition will now be continued by Professor Bekers. Professor Bekers was also a member of the assessment committee, and he also chair in clinical chemistry at the clinical chemistry department of the Maastricht University Medical Center.
Yeah, thank you, Prorector. Well, I also want to give you the compliments and congratulations, because I learned a lot about the flavor, interpretation and mouthfeel, and also want to congratulate your promotion team. I've read your thesis with a lot of interest, especially, and as already mentioned before, chapter 7 is very interesting, because I'm also a lover of a good glass of beer. So my first question, and it's a bit the same, or it looks like what colleague Havermans said. I'm very interested to become a beer sommelier. What I have to do for that?
Highly esteemed opponent, thank you for your kind words and for the question. If I understand correctly, it's how you can become expert on beer, or?
Yes.
Okay. So I think, first of all, you have to start with a lexicon. So to really understand the terminology, language is a big barrier, and I think especially on taste is a big topic to be discussed. So first of all, I will say is learning the language, and after really get trained on the different sensations. So what's exactly drying sensation? How saliva influence this? What are the matrix interactions? So actually there is quite a lot of complexity that you have to understand, and this is only part of mouthfeel. And when we start speaking also about aroma, and about aroma release, becomes also much more complicated in the end. But definitely we have to start from the basics, let's say.
Yeah. You, when you became a beer sommelier, you can do something else, or is that a job?
I think it's a full-time job. Yeah.
A full-time job.
Yeah. If I'm not mistaken, yeah.
Yeah, thank you. And then I think I don't go to do that. Well, because of your dissertation, I became acquainted with Scover, and Fons is now one of my best friends. You will understand, probably. But I want to go with you to table 3 on page 124. And you have presented there a lot of results. And one of my questions is how many measurements you have done to get these results?
These results are actually from the literature. So it's what the literature at the moment states about mouthfeel. And it's through the different years and how the different actually authors start describing mouthfeel. And this is interesting because you can see already that there are a lot of variation on the terminology. So even for the same product, like for instance beer, you have different terminologies. And actually, I believe if you are doing a real sensory analysis, what we did actually, and then introduce all these sensory terms, actually they're going to overlap.
Yeah, but these are chemical results.
24, right?
Page 124.
Ah, 100. Okay, then I'm sorry. 124.
It's chapter 7.
Yes, exactly.
I thought what you say. I didn't understand what you say.
And what was the question again?
Because
Sorry.
you have a lot of results.
Yeah.
And I want to know how many measurements you've done to get these results.
Everything was in Duplo, and actually there were 2 different labs that involved in this project, and so we also we compared the effectiveness of the labs as well. So actually every measurement is Duplo here.
2, but because you give standard deviations, there are of 2 measurements.
Usually there are 2 measurements, yeah.
Okay, well, in clinical chemistry we have to do more analysis to get a standard deviation. But well, I'm very curious about the ethanol concentrations you've measured. Are they the same as the breweries set on their bottles?
Yes.
Yes? They are
so
correlated very well, or?
They were quite close. Sometimes also you see some breweries, especially the small ones, that do not behave that well, so you have a bit of variation. But actually they were really close.
Yeah, really close. Okay. Well, that's very interesting. And then the second is KB. KB is the second on the list,
yes.
On the beer list. And then I want to ask you about the total iso-alpha acids.
Yes.
It's larger than 1, but I don't understand that. You can explain that?
Actually, it's lower than 1. So it's a below detection limit. So okay. Sorry, apologize for the confusion, but it's a below detection limit.
Yeah. Okay. That's increase different, or?
Sorry?
Is that increase different? Because I think it's larger than 1, or is that's a mistake?
It's a mistake. It's a mistake.
Okay,
it's a lower.
A mistake.
So it's below the detection. Yeah. Below otherwise, will be surprising.
Well, my first question was that I will become a beer sommelier. One of the reasons of that was because you said on page 127 that the relation between sensorial and chemical data. You stated in the first sentence there that the evaluation is time-consuming and expensive, and you think in the future maybe chemical analysis will you not need any more of that sommeliers. Can you give the difference between money that you spend on the sommeliers and on the chemical analysis? Is the chemical analysis then cheaper?
I think the main problem with the sensory is like you have big sessions. So first of all, also the problem is to find the people, and to train them also takes a lot of time. And on the other hand, when you have objective measurements, like if you do HPLC or GC, of course they're expensive machines, but like big companies, like in brewery specific, they have they develop specific device, and they can measure many components at once. So then the cost drops significantly, and this can be quite good way to go in the future. Like you have one machine that can measure different tastans, different components that are responsible for flavor, and you have a nice model that can translate and classify beers, for instance.
Mm-hmm. But in your study, is the money difference?
Instrumental analysis was more expensive.
What was more expensive then?
Instrumental analysis. Yeah. It was much more time-consuming, but the reason also was we tried to develop the methods, so we borrow them from literature, and also we tried to optimize them as well. And then it took a lot of effort and time to have something that is really sensitive and the accuracy is good enough for the measurements.
Well, Prorector, I have time for one more question. Well, I'm a clinical chemist, and you can see that there, I'm very interested in the chemical analysis. And we, on our laboratory, well, we perform about 4 million tests each year, but it's mainly in blood. And do you think clinical chemistry parameters will be measured in saliva in the future? If you ever speculate about that?
I'm not sure if I can understand the question correctly. Can you maybe rephrase?
Yeah, we measure in blood a lot of parameters, clinical chemistry parameters. I don't know if you're aware with that. And I think in the future maybe saliva will be also a material where we can measure parameters to look if people are ill, for example.
Yes.
Do you think that will be, well, an effort for the future?
I'm still not sure if I get the question, but I can maybe try to answer.
Yes, fair.
It's like if we can use like chemical analysis for blood. Is this the question?
No, I mean, we measure in blood a lot of parameters, and I think saliva will be in the future maybe also.
Okay.
I think we can measure it. For example, we measure cortisol in saliva, but maybe you can speculate if in the future more parameters can be measured in saliva. But what do you think about it?
I apologize for the confusion, and now I got it. Yes, indeed. I think it's quite an interesting solution that we have in the mouth. It's like really complicated, and I'm going to bring it a bit more on our field. Like, first of all, we use now saliva to predict mouthfeel, to be able to understand mouthfeel actually. But also, you could try to measure saliva. For instance, you can use oral tribology to see the effect of a different medication or a different illness. I think it's a really nice tool. I don't know how useful it can be on the clinical chemistry, but definitely in our case also really significant, interesting results. So probably can open a new door also. Yeah.
Because to get blood, you have to do a lot of work, and with saliva, it's really simple to get the saliva.
Exactly.
Have I time for more questions, or
A very quick one, if you want.
a very quick one? Well, I've had COVID-19, and I did after I had post-COVID, and my taste was very bad. I didn't taste anything, and now it's getting better. Have you suggestions for me how I can get it even more better?
My question, then I have to bring back to you a question. What exactly happened? Like, was more on the olfactory system? The aroma was?
When I had the post-COVID, I nothing.
Nothing. I'm not sure what exactly happened, but yeah, I'm not sure how you can really solve this problem.
I think it's a big problem. It's a big problem for everyone in the world.
Yeah, like on texture. I'm not sure if COVID influenced trigeminal receptors and mechanoreceptors, so I think the texture was there. But when we speak about taste and aromas, then things that were blocked. But I'm not sure how you can.
You cannot advise me to do something.
No, not at this stage. Maybe with a few
later.
Research.
Maybe we can discuss it with a beer. When we drink a beer both. Well, thank you for your answers. I'm very satisfied. I give the word back to the prorector.
Thank you very much.
Thank you, Professor Bekers. Then the opposition will be closed by Dr. van Strijdonk. Dr. van Strijdonk is a lecturer in material sciences at the Zuidhogeschool in Heerlen. Please, Dr. van Strijdonk.
Thank you, Mr. Prorector. Dear candidate, I also like to read your thesis. It was very, I learned a lot from it. I also like to congratulate you and of course your promoter and co-promoter. The interesting thing is that you focused on beverage compounds, on lubrication, effects on the saliva, and some very interesting analytical and physical chemistry. But I was mainly intrigued by the supramolecular chemistry that is also in your thesis. In chapter 4, you studied the effect of gallic acid and tannins on the rheology, I would say, as a material scientist. And you conclude that the aggregation behavior is very important, and you suggest that the aggregation leads to fixation of the proteins, and then there's more friction. But then in chapter 5, you look at different phenols with different numbers of OH functionalities. And there you suggest that that could be the difference. And that puzzled me a little bit. What do you think is the main mechanism for the fixation? Is that the formation of a dynamic polymeric networks, maybe fibromers you could maybe call them, or is it more the formation of a kind of suspension, colloids and maybe precipitation? What will be the main mechanism, or the different mechanisms?
Esteemed opponent, thank you for your kind words and question. Actually, indeed, there are different results based on the diameter between chapter 4 and 5. And what we actually saw is like when we use different phenols, they bind differently. And then we have different sizes. I think that also explains a bit the difference on the results. Like when we had gallic acid, that is a bit smaller molecule, was a bit, the aggregation was a bit more, was a bit easier. So on the other hand, when we had tannins, we had really big aggregates as well. But when we play with the different phenols, then the size were not making a lot of sense anymore. That's why then we decided also to study different parameters as the relative density and the weighting properties. And this was like, basically was another way of understanding what happens with friction. And with the relative density, we focus mostly on aggregated proteins. And if this can solve, but actually we found the highest correlation with the weighting behavior. So how well the saliva swells the PDMS surface, and when we had a really good weighting, then the lubrication was great, and the other way around.
But still, the number of OH functionalities in tannins and gallic acid are also quite different, and I can imagine that tannins can initiate a polymeric network more easily than the smaller polyphenols. Do you consider that as a mechanism or not?
I think definitely has a strong influence, like how you have the binding. But I'm not sure if it can be called a mechanism at this stage. Maybe with a bit further investigation, especially on these specific properties, maybe we can understand better if this is indeed a mechanism.
And what kind of experiments would you propose then to do, or what kind of techniques could help you there?
I think what is really important is to select well the phenols. That you have a really good selection of phenols that you can study specific group at a time. I will go for this direction. Then you don't have a lot of variation. Like in our case, sometimes we had a bit of variation because also there is like 3-dimensional molecules, so the binding can be different, for instance.
And the use of spectroscopy like UV-Vis or infrared or maybe even NMR, could this help you?
I think we tried also UVs as well. NMR, I have seen some studies, but I'm afraid that the saliva matrix, when we speak for human saliva, is too complicated maybe for the NMR to detect some. So it's a really sensitive technique.
I can understand that it's complicated. So that's why we chemists like to make the world a bit more easier by making model systems. And so you could use maybe just some proteins, some phenols, do some binding constants. Could that improve the insights of the network formation or not?
Yeah, this is definitely a great suggestion. The thing is, like, you have to simplify the system, maybe use artificial saliva at this stage to understand the specific binding between mucins or only glycosylated PRPs. So then you have only more simplified methods, and maybe you can use like UVs, or also NMR or Raman spectroscopy to really start focusing on the bones, for instance.
A related question to that, the monoproteins, they have a small friction effect in the presence of gallic acid. But also there, you look at the hydrodynamic volume. Could there also be that competition experiments, binding constants, could be also an explanation for your results. So if you look a bit more again into binding constants, network formation, competition experiments, could that be a next step to go?
Yes, because monoproteins is a masking agent, so it's really about competition.
Yeah.
I think it will be great if we can have different polysaccharides, and we can indeed use simplified models and try to understand better.
Thank you. Perfect timing.
Georgios Agorastos, the time appointed for defending your thesis has passed. The degree committee will now withdraw to discuss the quality of your thesis and your defense. I request that you and your company, the audience here, await the results of our deliberations and our return in this room.
Please all rise.
The PhD defense has now ended. The degree committee will debate the candidate's performance behind closed doors. This process usually takes about 10 minutes.
Long road to the south side, 7 miles in my rearview mirror. I know what it felt like. My goals only getting clearer. East side to the west side. No place like home. If it's questions that you've got, go the extra mile and die. I know what's on the line. I know you know that I can't read your mind. Years can't fly by now, don't waste all your time. Cause I'll go the extra mile. Long road to the south side, 7 miles in my rearview mirror. I know what it felt like. My goals only getting clearer. East side to the west side. No place like home. If it's questions that you've got, go the extra mile and die. On the dash, got my laces tied. Long road, I don't waste no time. Break rules because fate decides. With the team and we chase the light. I make a move, fall down, shake it off. I hate to lose, bad branch, break it off. No room for negativity, praise and love. Prepare for deep part cause we're taking off. Get the mileage, traveling so far from home. Gathering knowledge, other connections. I put the time in to get everything I ever hoped for. It's a challenge and we all in. It's a better future than we go for. And even though these nights seem long, I know that I am never on my own. Know you've won the battle once you've grown. Long road to the south side, 7 miles in my rearview mirror. I know what it felt like. My goals only getting clearer. East side to the west side. No place like home. If it's questions that you've got, go the extra mile and die. Long road to the south side, 7 miles in my rearview mirror. I know what it felt like. My goals only getting clearer. East side to the west side. No place like home. If it's questions that you've got, go the extra mile and die. What's on the line? I know you know that I can't read your mind. Years can't fly by now, don't waste all your time. Cause I'll go the extra mile.
I reopen the session. Georgios Agorastos, the degree committee here present has assessed the quality of your thesis and your defense. And in view of its positive verdict and taking into account your previous qualifications, the degree committee has decided to grant you the degree of doctor. Professor Bast is authorized to confer upon you this academic distinction in accordance with Dutch university custom. I invite your supervisor to now take the floor.
Please all rise.
Do you promise to work in accordance with the principles of scientific integrity at all times, to be careful and honest, transparent, independent and responsible?
Yes, I agree.
By the authority vested in us by law and in conformity with the decision of the committee here present, I hereby confer upon you, Georgios Agorastos, the degree of doctor and grant you all the rights attached by custom and law. As evidence of this, I now present you with the degree certificate signed by the rector, the secretary and the other members of the committee and affixed with the official seal of the university. The laudatio will be given by Dr. Peter Klosse.
Georgios, congratulations. It's a great moment to, I'm getting emotional. But it's great that you're here. It's great that you've finished your job, and we're very proud of you. And for the laudatio, I first would like to thank Alt. I'll get back to you later. But Alt, I remember the first time that we talked about this. It's a long time ago, and you were still rector of the Venlo campus. And then I found it as an adventure. It started as an adventure, and I'm very glad that you said yes to this adventure, because of course I'm not officially a promoter. I'm not a professor, so I needed somebody like you, and we were very happy that you took upon you this job, but also in learning how you did your job, we really appreciated your effort in making this work. Now, Georgios, you did it. And first of all, for congratulating you, of course, I realized that you said that yesterday, you're the first of your family to reach a degree like this. So I congratulate your family for doing that. Great. Also, on behalf of Alt, we're very proud of the work you did. It's an excellent job. You worked independently, and we said that just in the committee. Of course, many PhD students, they work as a part of the university, they are part of a team, and you are a real independent researcher. You did your job independently of other organizations, and it was very good that we spoke quite a bit to each other and that we were able to help, but you reached out to us, and you are real independent in your choices, independent in the way you conducted your research, independent in the way that you wrote your research, and then the next thing that we are very happy with is the way that you used the feedback that we gave. Of course, we did have feedback, and we did have comments every once in a while, but you took that upon you in a very gracious way, and you really tried to improve the work that you did. That's your ability to handle feedback, your ability to work with the comments that you got, the choices that you were also faced due to COVID, that you had to restart your organization, because then the labs were closed and we couldn't collect saliva, as properly was mentioned. So there were all kinds of hazards on our road, but you covered them, and you you just, in a very good way, you got around all that. And then we also figured through, okay, now we had a student, but in that case, it was she cannot work in the lab, so okay, let's do some literature work. And you all organized that very well. Which also brings me to another aspect of your work. You are a great supervisor of students. So all the students had quite a bit. I didn't do the count, I think 8?
Somewhere there, yeah.
8 were, let's say, helping you, and they all got high grades. So that's a very good sign. There was even an example of a student that helped you first in a part of the research, and that the supervisors of the university said, well, we doubt about this guy, maybe he won't finish his degree, but maybe you can help. And then he did a second research with you, and he passed easily with also high notes. So that's something very, very, very good. Something else, this is not a PhD like many others. PhDs are often, let's say, a sequence of researchers. And in fact, and this is also a personal note, this PhD started, let's say, as far as I'm concerned, it was about 20 years ago that I was here with this idea of the mouthfeel model. And indeed, it still is maybe for a little bit strange way of looking at taste. But it's a really connective way of looking at taste. It integrates all kinds of things. At my time, it was very, let's say, new. But you brought this whole thinking a lot further. And I believe that the base, you mentioned it yourself, the base for the mouthfeel model got stronger and better. And I am very grateful to you that you made that work as well. Let me see what I have mentioned yet. It's original, groundbreaking. In your last words, you said you had to work out of the orthodox box, and that's what this is. There is an orthodox way of thinking about taste. Often it is tasting and perception, and the taste approach is the molecular approach. It's new, it's objective, it's different. So you took that up. And then you also have to face, of course, the traditional, let's say, journals and peer reviews and all that. And something that is also nice to mention is that all the chapters, except for one almost, have all been published. They have all passed peer review. They have all passed in different types of journals. Let's say the peer review phase. And that's also something remarkable. In my case, that was certainly not the case, because it was much more difficult and much more unorthodox. But even in your case, still, it was unorthodox. And yet, you, with the let's say, the quality of your research, you made it happen. You passed the peer review. So I'm really happy. I'm happy that you made it. This crazy idea finds ground. That you can classify taste, that you can look at it from a molecular point of view. There's still a lot to do. There is a lot of future. And I'm happy with what the comments of some of the reading committee, that they also see I remember the question of Martin Bloom, who really also put up front, but also your question on the alcohol-free beer. In fact, that is a big question. So what is the alcohol sensation? It's partly burning, it's partly... So where do we place it and how do we replace it? And that's the same with salt, it's the same with sugar, it's the same with fat. As soon as we understand the composition of taste much better from this perspective of mouthfeel, then it's also much better to reformulate products and to reformulate things for the better of the people, for health, for whatever reason. So this is a great new step. Thank you so much. Congratulations again. And all the members of the reading committee, Prorector, University, ALT, thank you for your work on this and for recognizing the job that Georgios made, because he deserves it. Thank you.
Dear Dr. Agorastos, also on behalf of Maastricht University, I congratulate you with the degree you just obtained. And I would like to extend my congratulations to the family and friends and colleagues all here present or maybe online. Also my thank you to all members of the committee for all the efforts you put in, and especially to those who have traveled to get here or who have been participating from abroad. Thank you very much on behalf of Maastricht University. That brings us to the end of the ceremony here, and a few more instructions apply. We will shortly be taking some more pictures here in this room, also with the external committee members on board on the screen, and there will be some opportunity to still exchange a few words with them. Meanwhile, I would like to ask the audience here, except for the close family, to already move to the reception that will be in this building. I guess there will be some of you who know where to find it, and otherwise people will guide you there. And then we will take some pictures, maybe another one on the stairs, and join you there. Yes, please? And then hereby I close the meeting.